Hello everyone, we're going to talk today about IV supplies and how to start IVs with your IV pole. So we're going to first gather our supplies. We have fluids here. We're going to hang this bag on the IV pole. And then we have a secondary bag of fluids. So I just made an antibiotic, made it red so that you can see the color difference. So I put the antibiotic in this syringe and put it in to this port here. See, this is not sterile, so you scrub it with an alcohol swab, put the antibiotic in, shake it up. So this is your antibiotic now. So we're gonna do that. We have primary tubing, so this tubing goes to here and is gonna connect to this pump. And then secondary tubing is going to connect here for the antibiotic. We have our catheters to start the IV, tegaderms, flushes, IV start kits. What do they call these? Extension set with lock. And then just lock. And then there's different kinds of fluids. So if you see on table 13.1, you have isotonic solutions, hypotonic solutions, hypertonic solutions. I'm going to put on my gloves. Hand hygiene, put on my gloves. Open up my supplies, my IV start kit. We have your tegaderm, skin prep stick, alcohol prep pad, tourniquet, tape. So I'm going to get my tape ready for how I like to tape up my IV. Okay, got all my supplies ready. I'm going to tell the patient that this is going to get tight around their arm. You do want it to get tight so that you can see the vein. I sometimes, if it's a hand vein, I have them pump their hand and that vein will pop up a little bit better. So you can feel the vein. You want to make sure you have all of your supplies ready at this point. You want to keep your tourniquet on least amount of time as possible. I'm going to do my skin prep. Okay. Then I'm going to take my needle. I'm going to have my flush and my loop ready. Okay. So pink. What gauge is pink? 20. So you can see that this has the plastic piece on top. You want to make sure the bevel is up. So you go in at an angle. So I already cleaned my area. I'm not going to retouch. I'm going to go in. Sorry guys.
His skin is much harder than normal skin.
Yes. So I'm in the vein. I'm going to advance the plastic catheter, pull out the needle, screw on my loop, just like that. Flush, make sure it does not infiltrate and bubble up back here. Works good. So now I'm going to tape it down. I've been taught to do a X pattern like that. Just like that. And then I'm going to take my Tegaderm. Make sure you put it over the plastic and the whole entire tub. And then I can take this off, take my tourniquet off. I can take this and tape this here, and then this is where I would connect my IV tubing. And you're going to time, date, and initial your IV start. Here is what comes in every IV start kit. So date, time, gauge, name, who started it. Companies or hospitals have policies on how often IV sites have to be changed. So each facility will have this. And so I'm gonna write my name, date, initials. It's a 20 gauge. So then we are ready to start infusing the antibiotic we practiced earlier. Start by priming my primary fluid. I'm gonna open up the package. This is what it's gonna look like for the plum style pump. So this is the spike. This is a clamp. This is also a clamp to pull in and out. You can see on your tubing. This is a port or hub, this blue. You can insert medication into this as long as it is compatible with the solution. So we're going to start by doing that. So you want to make sure that your clamp is locked so that when I puncture the bag, it's not just going to run through my line. So I'll show you why that's important just here in 1 second. So I'm going to undo the port here, hold this and not touch, just go straight in. I'm going to fill the chamber about half full so that I can still see the drips. So then this is where I'm going to open up. This also has a connector on the bottom, so just by dropping it, it's still okay. It's still sterile because of that. So I'm gonna open up this white clamp here, let the fluid run. When this chamber, I'm gonna flip this chamber. When this chamber fills up, I'm gonna flip it back over and it's gonna finish running down the tubing. So this is important for bubbles. The plum pump is not going to work if there are bubbles in this chamber. So as you can see, there are no bubbles because I flipped it. So we're getting down here towards the end. And with this all the way primed, we will have a few drops once it gets to this end. Still coming, I see it's right here. You can see the difference between the air and the fluid. And I'll show you that with the red colored solution here in just a second. So we're close, we're close. It's coming. So it's right here, almost to the end. So I'm gonna get it all the way to the end and then I'm going to close this clamp here. There it is, there's a drop, close. Okay, so then I'm going to open up this, put this in the slot. Okay. There we go. Okay. Now this is connected to the patient. So I'm just going to use the counter as the patient. So I connect that into the patient after I've started the IV, of course. And then the patient needs an antibiotic. So I mixed up my antibiotic like we talked about. I'm going to use the secondary tubing. So this is a roller clamp. This is on some tubing. Instead of the plumb clamp, it would just be this clamp. If they're going to surgery, it'll just have this kind of tubing because the anesthesiologist likes to just be able to control the flow of the medication just with the clamp. So the secondary tubing has just the clamp. So I'm going to completely close the clamp to spike my antibiotic. So I take off and get my spike ready. So I mix the medication in this port and I'm connecting into this second port. Up like that, give the chamber a squeeze. I can see the drips. So now I'm gonna prime this tubing. I'm gonna see the red get all the way down here to the end. So this flows pretty fast. So I just kind of half unclamped it. And here it comes and boom, it's there. So it's pretty fast. So to run your antibiotic, I'm going to connect it into, for on the plumb pumps, I'm going to unscrew this white right here and connect it right into the pump. And then this comes with every secondary tubing. So I'm going to lower this bag of fluids. I'm gonna lower the primary bag of fluids and have it like that, because that means that this is higher, and so it's gonna work by gravity, and the red is going to flow faster than the white. And so once the red is done, it will switch back over. The pump is going to do that. I'm gonna turn on the pump here. Most pumps have settings. So we're going to be in adult critical care. So I'm just gonna hit enter. It's asking me what do I want to run for chamber A. So chamber A would be my primary. So I'm going to run it at 100 milliliters an hour. And the volume to be infused is how much fluid is in this. So 500 mils, but I'm actually gonna put 490 on the pump because I ran some fluid through the tubing. So there's not all of 500 in there. And you don't want your line to go dry. So I'm going to start that, confirm the program. So that's gonna start pumping my primary line onto the table here. So it is pumping at 100 milliliters an hour. I can hit B and go to my antibiotic. So the rate I want to, yes, I want them to be concurrent. Or I can just switch it to where I can have just the antibiotic going and stopping this fluid. But I'll go ahead and just do concurrent. I'm gonna flow this one a little faster, 150 milliliters an hour. And we have 50 mils in that. So I'm going to put 50. Because there is all 50 in this because it hasn't reached the chamber. We'll start. I'm going to confirm my program. Make sure that is unclamped so that it can actually run. And then you will see the two fluids merge together. You can see the red is going into the pump chamber now. And then you'll see red come out this tubing. So we walk into the patient's room. The doctor has ordered for the patient to be hooked up to an IV. So the patient has been saline locked for a few hours. So you're gonna walk in and you are going to clean the site. So for 30 seconds, you are going to clean the site, scrub, 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 and then you always have to flush the IV before administering medication. So it comes in a pre-filled syringe flush. So you're going to flush the whole syringe. I'm not actually going to flush it just because this is a mannequin. So you flush the solution. This is just sodium chloride. And then you are going to hook up your IV. Screw that down. You can always tape up higher so that it is not flopping around. Just do a couple pieces of tape and so the patient doesn't get caught on something. And then you're going to go to your IV pump and you are going to hit start, and you are going to make sure all your clamps are unclamped all the way to your patient, including the clamp on the saline lock, to make sure all your clamps are running. The machine will beep and tell us if something's occluded. So just keep in mind of that.